Hello, everyone. It's Phil Jacobus. It's November 5th. I'm in my office in New York City. We still don't know who the president is going to be. It's looking like it's going to be Joe Biden, but no one, it's until uh, until it's over, we don't know. Um, Hopefully, we'll know Monday. Anyway, today we're going to be joined by Thom Wellington with the Infection Control University. Uh, what could be more timely than than the Infection Control University? And I know that you'll find this to be interesting. Thom has been a contributor to our magazine, Healthcare Business News, for which we're grateful. But before we're joined by Thom, let's take a look at a couple of the stories that have occurred in our online news today. One, you see that Intel has made a deal with MRX Imaging for reconditioned imaging equipment. This is a great thing, a good deal. I wonder how the Vizient Vizient GPO purchased Intel. I wonder if it affects the arrangement in any way. You also see that Accuray has partnered with BrainLab on a CyberKnife neurosurgery system. We have a lot of advertising for the CyberKnife in the New York City market, and this will be an interesting addition. COVID-19, there's a story about what we're losing on COVID-19, but what it's costing hospitals. These are all interesting stories. Our news is free. You can sign up for free. You can target the type of story you want to receive. You can also read our monthly magazine in print if you don't receive it in print. So please, I encourage you to go to .med.com and click on the Healthcare Business News tab and sign up. Hello, everyone. And as promised, today I'm joined by Thom Wellington, who is a co-founder and executive with the Infection Control University. Thom, if I may call you that, thanks so much for joining us.
Oh, thank you, Philip. I appreciate the opportunity.
Thom, it's safe to say, is a genius, and he's contributed a lot to our magazine and worked with us and provided some very interesting content. So all of us here at Healthcare Business News know the Infection Control University, which we affectionately refer to as the ICU. But Thom, for those of our viewers who aren't familiar, can you tell us a little bit about Infection Control University?
Yeah, I'd love to, and thanks for the opportunity to do that. I appreciate it. Well, Infection Control University, ICU, as we sometimes call ourselves, was formed to aid healthcare systems in reducing HAIs. And that's hospital-acquired infections. It used to be hospital-acquired infections, and they've softened it a little bit, or hospital healthcare-associated infections now. ICU develops customized critical communications programs, and we educate the contractors and vendors that come into the buildings on infection prevention protocols. And we make them part of the clinical team, which is important because once these people understand how their work can make someone sick or develop an HAI in the building, then they're much more apt to play by the rules that we set up. And it's all goes by that Simon Sinek treatment of if we tell them the why, then they understand it better and they'll follow the rules a lot better. So our job is basically to tell these people that come in to do work 24/7 in our hospitals, and they're the contractors and vendors, and they work on everything in the hospital. Hey, these are the things that can make one of our patients sick, and these are the practices that we want you to follow. And they're appreciative of it. Rather than just throwing rules at people, they want to know why they need to be doing things a certain way. And that's really what we're after with Infection Control University.
Now, do you also offer training for hospital employees, or do you feel it's not necessary?
No, it is necessary, and especially the housekeeping people and the maintenance staff, the engineering staff. Sometimes it's a good onboarding program as well for nursing, and everybody needs to understand what can make a patient acquire an HAI, and they don't understand the costliness of this. Not to mention, we want our patients to go home healthy. We want to have great outcomes in the hospital. So yes, everybody benefits from more education. And it's just like having a football team out there. And if the team doesn't know the play, they're not going to go anywhere. So part of the play is telling everybody what's important and how to keep our patients safe.
So I know that over the years you've visited quite a number of hospitals, and I think you're visiting hospitals even now. What trends have you seen since the onset of COVID-19, and how are hospitals dealing with these trends?
That's an important question, and I have seen one major trend, and actually it's evolved even more in the last couple of weeks, is as I go into hospitals, all the entrances to the hospitals, where we used to be able to access a hospital from the medical office buildings that were connected, or we could go in from multiple side entrances, and even from the loading dock in most places. Now all those are locked, and everyone, including the vendors and the contractors, have to go through the front doors or through a door that's set up with someone that's certainly going to ask you a question concerning COVID. If you've been around somebody, we all know the routine: take your temperature, and then possibly ask, what's your purpose going into the hospital. So, Philip, a big trend basically is the fact that the hospital has really shrunk down all the entrances to maybe just a few. And we were after hospitals for a long time trying to get them to do this. And they wanted to do it because we wanted to have them check people as they came in and make sure they had the proper training before they did work in the hospital to keep our patients safe. And now, and they were looking at it before because of the violence that had occurred in hospitals, but now with COVID, it's mandated it, and everything has changed. So that's one big item that's changed. Now, a week ago, I had a facility manager said, the people at the front door that check you, the nurses and the people that check your temperature and all that, he said, well, that's, instead of under the nursing's department, it's now under my department, and this is the facility manager. So we're even seeing people shifted away from a clinical cost back down to a maintenance cost, having that staff there, having them there 24/7 or whenever's needed in the hospital. That's another big trend that just all of a sudden now, that's another shift that's just gone on. But I think it's a good thing that we've narrowed down the focus of how we get in. It's almost like a funnel. We brought it all back down to one or two different points where people enter the hospital and they're being questioned for the most part. What's your purpose?
Yeah, and of course, telemedicine is helping with that as well.
Well, it's tremendous, and they've done a great job with that. And I have some hospitals that we work with that are strictly telemedicine hospitals, and they are growing like crazy. It's been great benefit. COVID has worked out for them as a trend.
Now, I would assume that hospitals need specialized training to benefit from your university. What do you offer? Some sort of training like this?
Yeah, well, here was kind of the concept of this with my partner Tom Sears, who's a brilliant person. We had gotten together, since I'm in the hospitals all the time, and he really understands the cloud and how the cloud works and what benefits we could deliver to the hospitals. What we did was we thought, if we go into the hospitals, we meet with the infection preventionists, the facility managers, and the other stakeholders within these facilities. They're going to tell us what the important concepts are that they need to get across to anybody that comes in the doors to work in the hospitals. And I think we're seeing that with major healthcare systems across the country. Some of the top 3 healthcare facilities use our programs because they don't want anybody coming in to their facility until they've been trained and understand how their work could actually cause an HAI. And an HAI on average cost the hospital about $45,000. So we're talking about something that not only costs a lot, but then we usually have a readmission involved, and then we have a poor quality score when we have an HAI. So it's almost a triple whammy for the hospitals if they don't take care of that patient and make sure that they're safe. And all of us that work in the hospital have to be a participant in making a safe environment for those people.
Yeah, not to mention some get sick and die.
Yes. And we all know somebody that's had an HAI. I mean,
Yeah, yes, it's
it,
true.
and
It's
it only takes one colony forming unit of dust or fungi to get to a patient that's immunocompromised and cause a problem. And I think another trend, Philip, that we're seeing is the clientele, the people, the patients that come into the hospitals are much more cognizant now and being worried about infections. But before 8, 9 months ago, we didn't even wear masks. And now you can't even get into a hospital without a mask. And we want to make sure that the workers and everybody in the hospital are following proper protocols.
yeah.
And our customers are much more intelligent and educated on how infections occur and what should be safe practices in the hospital.
Now, how does the ICU deliver the education? Do people come to your university, or is it online? What's the process?
Yeah, actually, we meet with the hospital and we develop uh, a program that's customized for their specific needs alongside of what we feel are great needs and what we've found to be successful at other healthcare systems. And then we develop a training program and then we place it on the cloud. And the benefit of having all this training on the cloud is we don't want these people coming into our hospital for training. We'd rather have them do the training at home or online, and we make it available 24/7 online. And we take care of everything for the hospital. So the hospital's pretty much hands off. And it used to be an issue. They knew they had to do this type of training because the CDC had recommended it, that everybody that works in a hospital should be trained on a yearly basis on infection prevention and infection control protocols. And most hospitals weren't doing it because their people were overworked for the most part. So we took all the work away from them, put it on the cloud, made it easy. We send out the reminders, all computer based. We track everybody. All the records are on the cloud, so nobody has to even do anything other than just push a couple mouse clicks, and they get their information.
And pay attention.
Well, those that are taking the class, certainly that they pay attention, and we try to make it interesting enough, certainly, that
And
they're
you,
going to enjoy the training and feel like they've really learned something.
so I can take the class in the morning, you take it in the afternoon, and my wife takes it at 8 o'clock tonight. Is that right?
That's anytime they want,
Right.
any smart device.
And they're little modules, and they probably at the end they take a little test.
That's correct.
Yeah, well,
And they're all developed for each individual facility and or healthcare system. And it goes over all their rules and regulations as well as training them on all these clinical aspects of preventing an HAI.
well, that's a really, really, really good idea.
Yeah, it makes sense, and it's catching on. It right now everybody's busy with COVID and trying to get through that. And I know people are shorthanded and people are worn out in the hospitals. We're certainly seeing that with the EVS staffs in the hospital and some of the facility staffs. These people are working constantly and they're losing some of these people in some places. So that's been a big issue.
Yeah, yeah, it's got to be. It has to be really hard on hospital employees. It's hard to stay and it's hard to leave.
Yes.
Because they probably feel bad about leaving, and maybe they've just reached a point where they just can't take it anymore.
Yeah. And at the beginning of this, Philip, as you know, probably better than anybody, we saw a lot of healthcare systems cutting people too, because they didn't know what was going to happen. They closed down their facilities, except for COVID patients. They weren't doing any operations. And we still see, I saw today, 3 or 4 hospital systems that no elective surgeries right now because their case counts are up so high.
Now, I don't know if you have any visibility into this, but are outside contractors doing building or renovation or upgrades within the hospitals even now, or is all of that on hold?
Yeah, a lot of it's limited, and we do see that on a daily basis because that's really one of our focus points for the hospital is making sure we track those people down and that they have been trained. Um, you're correct in the fact that it dropped off quite a bit. Some systems actually stopped all work, and we're starting to see it come back a little bit. But then there's always necessary vendors that have to be in there, the people that take care of the MRIs and the
Yeah.
CAT scan equipment and the HVAC system equipment for these hospitals are all critical. And so we still have plumbers and people like that that come into these facilities, but not on the big basis that we did before COVID hit. But I think it's coming back slowly, and it will be back, probably the first quarter of next year.
Now, if I might ask, do you develop a different curriculum for a different level employee?
We can do that, and we have done that. It really is where the weakness is in their system and where they need that shored up. And I think a lot of them are starting to see the value of the cloud now. It's also, I might have mentioned that Tom Sears has set this up so that we're separate from the hospital's IT staff and from their computer network so that we can't ever cause a problem or a ransomware thing or something like that to enter the systems.
A HIPAA
We're
thing.
completely separate.
People log on to you the way they log on to that thing my wife does, Facebook.
Yes.
So that's very exciting. It sounds like a very, very interesting and useful program that you've developed. And
Well, it will save hospitals a lot of money if we can cut down on the HAIs. It improves their quality for one, and you would think every hospital is interested in improvement of quality and patient outcomes. We're reducing readmissions, which they can get penalized from, and we're reducing that cost that's involved with an HAI, not to mention the indirect cost that occurs. My father went through one, and an indirect cost with an HAI is now all of a sudden you've got to drive your father, who used to be able to drive, to a doctor's appointment, or now he can't work, and now you've got to have a nurse at home. It just blossoms and mushrooms. This is a big deal, and really can impact families in a large way. And if we can keep it from happening or reducing it, hey, that's our goal.
not to mention the lack of confidence that other patients have in the facility, knowing that someone got sick there.
Right, and I think we've seen that just after this COVID. After this started, people were, and still are, a little bit skeptic about going into the hospital. I don't want to have to go there unless I really have to go there.
Yes, I feel that way.
Yeah.
I feel that way, and I'm just a vendor.
So our job is to make it safer and make it work right, at least for the teams that we educate.
Do you offer any other sorts of training, or strictly infection control training?
That's it for right now. That's been our focus. We'll probably expand out of that as needed. I think we've seen some of that might occur eventually in training people to perform proper types of cleaning of endoscopes, endoscopic equipment, and things like that. We've seen some weaknesses out there where we can shore them up, but we still have to research that. We want to get our initial business into a strong point.
Okay, well, how old is the Infection Control University, incidentally?
Yeah, we're 6 years old now, and we handle probably 78 hospital systems across the country. So we've got a good number of people that we train on a monthly basis that are going in and out of these hospitals, and it is a yearly thing. And you would recognize many, many, many of the top ones in the country that are using our systems.
I'm sure we would. Well, Thom, gee, you have it's a really smart idea you came up with, and it's not only, and it's universally timely. So congratulations on a great idea, and congratulations on doing good work, because God knows that you're helping.
Yes, we are, and I appreciate it. Thank you very much, Philip.
And I appreciate you joining us today, and uh, I hope you'll keep us abreast of things that you're doing so that we can share it with our readers.